And it makes me think about the whole role of a radiologist, because you have such a technical expertise that you have to be in your field. So how do you balance the need for your technical expertise with your role as a leader?
So it's an interesting question, because the technical expertise is kind of a safe haven for us all to retreat into. It's something where, again, and I happen to be privileged to practice as an interventional neuroradiologist. It is, as you can imagine, it is extremely joyful and gratifying when you can participate in a very fundamental way in improving the health care for an individual. It's very, very tangible when you're dealing with patients with strokes and aneurysms. On the other hand, it can be devastating when you hurt people. And it causes you to kind of reconsider why you go into a particular space, whether you're really contributing in a substantive way, whether the quality of what you're providing is adequate. So it's interesting, because the technical expertise or the technical practice of radiology, which I engage in. Again, I take call every other night. I do cases every week, multiple cases, and I love doing them. But it's not an end in itself. It's not a matter of my doing the technical cases because I want to affect one life at a time, even though one life at a time is a significant thing. But that's supposed to be extrapolated to something greater. So in my practice, I try to understand how I can improve and better systems. Not naturally, I'm a chair of a department, so the expectation is that when I'm doing cases, I'm in the trenches, and I can understand the frustrations my faculty face. If the transportation services aren't working appropriately, if the inventory is not there when it should be, if the machine goes down, if the cleanliness isn't ideal, if the rooms aren't turned over in time, well, unless I'm shoulder to shoulder with them, I'm not going to appreciate and understand that. So I have a very strong opinion that leaders have to also serve on the front lines a significant percentage of the time to fully understand the frustrations and the issues that their charges face. Otherwise, my sense is that technical expertise as a standalone is not adequate. So it's not meant to be a safe harbor, because it's something I've been doing for the greatest amount of time. It's supposed to be a mechanism and a method for me to understand what it is that all providers of radiology services face: technologists, nurses, and the various individuals that I have to work with. So it's all about process improvement. And it's interesting. There's one article that Kathy, you suggested we read, The 7 Transformations of Leadership. And it's a beautiful article because it shows kind of the hierarchical evolutionary scheme for leaders. And clearly, one of the steps is a step that focuses on technical expertise. And it's that expert step where you really know a lot about a particular domain. But as you look at this hierarchy of growth as a leader, once you are an expert in a particular domain as an individualist, the next stage in evolution is understanding how you extrapolate from your individual ability to what's collectively beneficial, to understand what convention is. And then as you want to grow from there, the next step is to become creative, and then ultimately moldable and adaptive. And then you want to look at a system and recognize how you can allow or encourage a system and a culture to evolve in a beneficial way. So again, the technical expertise allows you to be part of a jigsaw puzzle, but you have to continuously, and one of the other articles that you gave us kind of drew this analogy beautifully, you have to be able to go from being on the ground to being up in the balcony and seeing intermittently what your contributions are in terms of what they provide, where societal texture is concerned, where healthcare improvement is concerned, and how your interactions with other individuals around you work. And the reason we're here talking about leadership is we understand that there's more to fulfillment than just doing your job. That fulfillment means also setting a course, understanding that you can contribute in a particular direction to create and contribute in a more substantive way. So that technical expertise plays a role, but it is simply a role. It is not the totality of what a radiologist provides.
Great. Well, thank you very much. That's really thought-provoking as you really think about the balance between your technical role and your role as a leader in an organization, really helping move forward. And it makes me think back to your talk about when you were talking about the healthcare and the next 10 years. And when you think about those next 10 years and you think about the role of personal leadership, how are you seeing the participants on this call and the real role of personal leadership? How's it going to continue to impact the profession going forward? What can we do to really help move the needle on the radiology field?
The sense I try to share with individuals as we have this conversation, because it's kind of a prolonged conversation, but it has a couple of elements to it. One is and it's kind of the yin and the yang of life. I mean, on one hand, you want to understand how you roll up your sleeves and how you have to shovel the trenches to kind of make sure you have an ordered framework for what you're doing. There's difficult work to be done, but on the other hand, you have to focus on the optimistic and the upside. So let me start with the optimistic side, and then I'm going to talk about the balance, about the stuff that's happening that's new, that can be scary, but shouldn't be. So the upside is if you participate in an evolutionary step, that allows you to make a creative contribution. When you make a creative contribution, you feel as though your life is impactful. If you're gliding along on easy street, you're not going to be listening to a leadership lecture. You're not going to be interested in expressing leadership. You're going to be interested in following, not leading. If you're interested in leading, it's because you want to have a beneficial impact. You want to express your creativity. You want to feel as though your contributions are meaningful. And so this is the time to be able to express that because of this critical juncture, because of all the things that are happening. So that's the upside. So what provides us with this opportunity? Well, margins are decreasing. Throughput has to increase. We have managers in hospitals who expect return on equity explanations for every little tiny purchase. We have physician organizations that take away our money and redistribute it to other parts of the organization. So what we're facing is all kinds of intrusive processes from multiple middle managers that add additional complexity to our lives and trip us up. So we have to be patient. We have to be directive. We have to have the right terminology and understanding of these processes. It's one thing to hear about a business plan. It's an entirely different thing to craft a business plan that allows you to execute an initiative. You have to have that degree of familiarity. That's why specialized knowledge is essential. That's why courses in particular areas with directed reading are necessary if you'd like to sit at a table and have discussions with individuals who can define the course of your livelihood. And so it is important to learn and to read and to structure your thoughts in a way that will allow you to enter the dialogues and to steer them. So that is absolutely essential. So I believe that as you look to the future, radiologists have to participate on the educational side in a way, learning these concepts and integrating into these structures in a way they have not had to do so in the past. This is a new day with new demands, and we have more to lose. So we have to be involved, we have to be integrated, and we have to be motivated.
Great. Thank you, Dr. Norbash. I think you have a couple questions you'd like to ask the group at this time. So
I think one natural question, as you extrapolate from your personal experiences, and this is echoing Kathy's question to me, what are some of the biggest challenges that you feel are going to face you as leaders in the radiology field in the future?
And it's actually interesting. Go ahead and raise your hand, but while we're waiting for people to raise your hand, we've actually already had a couple challenges that were being chatted in. Just to share with you, people were talking about how, it's very difficult when you have a chairman that's a scientist, not a clinician, or when you have a layer of administration who hasn't been through the chaos of practice and they don't understand a lot of the difficulties that are faced in the radiology field, or when you're a younger partner and there's some resistance to new ideas coming in. So those are some of the things that have been chatted in. But go ahead, raise your hand, and let's hear from you.